I work in the Community Impact Division. I'm a Community Impact Officer. I was the original one. We go to certain places for repeat calls for service and things like this. And a lot of the calls for service that we get, people are in need of some sort of resource. Also, I work with the city and some of the zoning and code enforcement issues that they have. Kind of try to help mediate those things, mediate neighborhood issues. I do an awful lot of things. I'm happy to be here. This is a great gift for me to be able to be here in this community. And after all, this community is the community that I serve, and I'm a part of this community, and it means a great deal to me. And the people of this community pointed me to do what I do right now. Having said that, though, the drug addiction epidemic here in Sandusky is pretty strong. We have lots of opiate addictions. We go through lots of suspected overdose calls day to day, but we're not alone. All Erie County and really across America is dealing with the exact same things. You can't just pick X on the map and say that's where the problem is. No, it's everywhere. It's in our backyard, it's in your family, it's in mine. I had a recent family issue with losing one of my family members, and that individual and I were speaking, and what they were conveying to me was that they didn't like what they were doing. They were not pleased with themselves. They feel like they had let everyone down. The thing that broke my heart the most is that, irregardless of what we all were trying to do, and the family and their friends were trying to do to help them, they felt that they were safer locked up. And as an officer, most people will tell me that they don't want to go to jail. I've never heard somebody say that they feel safe in jail because they can't get high. Life is painful. It's not puppies and rainbows. It's hard. If it was easy to be successful in life, everybody would just walk around with everything they've ever wanted. When you're dealing with it through addiction, that's kind of like the one thing I want to just convey to some folks. It's not just you that's going through this stuff by yourself. It may feel that way because you're the only one who's physically ingesting and having to deal with the urges, the illnesses and things that you're going through with that. But the silent victims of this are your family members that have to sit there and watch, and they're concerned for you and have to worry every night if you're going to be able to come home. Are you alive right now? They're worried about what's next for you. Just open your eyes and look who's out there. Look whose other lives you affect. It's not just about you. It's about the other people that are around you and how much you mean to them, because you're important to them, and you do matter, and you matter to them. Even if you don't feel like you matter to somebody. Just open your eyes. And sometimes it's hard to see yourself for who you are. You are important. You're important to your family. You're important to your friends. Just look around. Don't let the circumstances around you become your reality. You can do better than this because you're worth it.